Hi everyone. Me and Maddie's current events article is titled Many People of Color Worry Good Healthcare is Tied to Their Appearance.
The article we chose is a popular media article discussing that people of color worry that racial bias affects the quality of healthcare. A study found that 55% of Black adults worry about their appearance going into an appointment and that it could affect the quality of healthcare. This is detrimental as the lack of respect and feeling comfortable that was reported may affect willingness to reach out for help or lead to more frequent switch of providers. And we know from our lecture for this module that discrimination also leads to anxiety, loneliness, and depression.
The author's purpose for writing this article was to bring attention to the racial disparities present in the quality of healthcare people receive, as well as the additional fears and anxieties that stem from this lower quality treatment.
From our lecture, we learned that disadvantaged groups must overcome healthcare barriers such as worse health and experiences and increased anxiety going into appointments. Also, from our lecture, we learned that there is a disproportionate number of physicians of color. In our article, Black patients reported more positive experiences with physicians of their race. So to connect this to the content, if there are less physicians of color, there is more likely than not more negative experiences for Black patients. Disparities also contribute to a higher rate of death among minorities and limited access to resources. Anxiety, unfair treatment, and loneliness may contribute to the hesitation to seek medical help.
Along with other forms of discrimination, an alarmingly high percent of the people interviewed belonging to racial minority groups experienced one or more kinds of healthcare-related discrimination. The article was not peer-reviewed, however, the information was gathered directly from individuals who are a part of these groups, most of whom have experienced these racial biases firsthand.
Like we talked about when explaining the author's purpose, we think that the hope is that more people acknowledge bias and gain a better understanding of its real-life disadvantages, especially healthcare providers. As future speech pathologists and audiologists, we can take away that we also play a role in creating an inclusive environment. The quality of care that we provide should be equal despite race. Appearance does not and should not have any effect on the quality of care that we provide. And we must be considerate and acknowledging of the barriers that disadvantaged groups are challenged by every day.